Hello and welcome to the Integrative Medicine vlog. I am Haley Villhauer and this is Lemecia Lindsey here with you today. We are both working at the Vancouver Wellness Studio and are very, very excited to be introducing our guest, Dr. Maral, and I'll hand over the intro to Lemecia so you can give us a little bit of history because Dr. Maral has a lot behind her education, and we want to bring that to the table because she is an expert in many regards. And today we're going to be talking about intermittent fasting. So we'll get to that after we do a little intro. But yeah, thanks for being here, Dr. Maral.
Oh yeah, I'm so
Right.
excited. Thanks for having me.
Yes, so I'd love to share a little bit about Dr. Maral. Dr. Maral Zarandi is a licensed naturopathic physician at Vancouver Wellness Studio in Vancouver, Washington. She attended the University of Washington for her undergraduate degree and earned her doctorate from Bastyr University. She primarily focuses and utilizes functional medicine perspective to find the root cause of conditions that patients may have, and she spends time educating clients to help them feel more confident and informed about their health. Her specialties include metabolic health, hormones, and digestive dysfunction. And we're so glad to have Maral join us today and share her expertise around the topic of intermittent fasting, sometimes referred to as IF as well.
Yes, perfect. Yeah, I know. I'm really excited. Actually, what's funny is intermittent fasting is perfect for all those things: hormones, metabolic health, digestive function. So it's widely being applied to a lot of health conditions nowadays, and I feel like it's definitely gained some traction in recent years. And so it's perfect time to discuss kind of what it is and how you can use it.
Great.
Yeah. I was excited when we were going to have you on to do this discussion because, as I think I mentioned to you, I get this question as a registered dietitian, functional nutritionist all the time with my clients where they're saying, okay, is intermittent fasting good for me? What is it even going to do for me? And how do I know if I should be, stepping into this? And before we go into any of the details and all of the kind of amazing things that can happen when we look into fasting, I would love for you, Dr. Maral, to just share with us a little bit more about why would we even want to consider intermittent fasting, and maybe some of those key benefits that are more applicable to everyone, and not so specific per se. Are there some of those that you could share with us?
Yeah, definitely. I mean, intermittent fasting, essentially the most researched outcome thus far from fasting in general is helping improve insulin sensitivity. Like that's the one where there's a lot of applicable data. A lot of the randomized control studies have measured the insulin response of fasting. And what we're finding is that insulin resistance comes down significantly and helps actually increase insulin sensitivity when you do fasting. Which is huge because insulin is like a mega hormone. It's involved in storage. If I'm sure everyone, I mean, it's the primary driver of diabetes, which is such a profound diagnosis nowadays. It has a lot of signaling connection to your hormones. And so for overall health, insulin is huge. The other thing that's becoming more researched, I mean, fasting has been around for centuries, but nowadays we're actually doing more research studies around the effects of fasting. And so although it's been implicated for years and years and used in many cultures, and especially a lot of like religious organizations use fasting and a lot of that, but some of the other benefits that we're starting to notice is it actually certain kind of fasting can help stimulate stem cell production, autophagy. It's huge with weight loss, especially for people that have maybe a little bit more stubborn struggle with weight loss, and it doesn't come as easy as for others. We're starting to see it in being treated for inflammatory conditions, autoimmune conditions. It decreases blood pressure. It helps with your lipids, so cholesterol, triglycerides, LDL cholesterol in particular. I mean, the facets are huge. And so this is just the beginning. And as I think the coming years and more research goes, we'll get a better understanding of what else it can happen, or what else it can benefit. But just even that is huge. And then the other one is, like, I feel like commonly missed, but the microbiome, the benefits it has for our gut bacteria are huge. And so that's one that I definitely like to touch base on with my patients and talk about how to use that and when to use it for that.
Yeah.
Great. Oh, go ahead, Haley.
I was going to say that brings me to our question of, like, is it good? I mean, all those things you just listed as benefits, like improved blood sugar regulation and potential weight loss and digestive improvements and, you know, hormonal balance being brought back into it. Seems to me like it sounds awesome for a lot of people. Are there contraindications? And I know we had previously talked a little bit about, like, pregnant women or nursing, or are there individuals who should not just be overly excited to jump on this intermittent fasting more fad, even though it has been around for a long, long time?
Of course. Yeah. I mean, there's always, like, who is this really for, right? I mean, we can't assume that everyone under the sun can use it. But when we talk about fasting, we have to talk about the different kinds. So I think that's important to touch base first, because then we can jump into the indications and contraindications. So fasting is a pretty big term. It's kind of an umbrella term for different kinds of fasting. So I think the most, like, famous one, or most commonly probably used by patients, is time restricted feeding. So intermittent fast in that way. And what that means is essentially you're going a period every single day of a fasting window and then a feeding window. So the most common one I think we've come to determine as being beneficial is 16-8. So a 16-hour fast, 8-hour eating window. Some people believe in a longer fasting window, so 18 to 20-hour fast. Some people, use a shorter fast, so 12 to 14 hour. It just really depends on the therapeutic goal. With time restricted feeding, weight loss does happen. It's slower than with other types of fasting, but it still has the same benefit for your insulin. The other kind of well-known fast is an alternate day fast. And what that means is for every other day, you either fast for 24 hours or you eat less than 500 calories a day. I think it depends on sustainability, right? So if we want someone to stay on it longer, we're going to allow them to have 500 calories. If it's more of a short-term therapeutic effect, that needs to be a little bit more drastic. So for patients with insulin resistance, type 2 diabetics, we want to implement more of the 24-hour day fast, because that's going to clear up the sugar stores quicker. That one, you will have the faster weight loss response, but it's harder to maintain, right? Because a lot of people will ask, well, what if my fast day falls on, a child's birthday party, or like I'm going out with friends, right? And so it can really be dictated by your schedule. The other common one is the 5-2 method. And so that's where you have 5 days of eating normal calorie content and then 2 days of fasting. And those fast days can either be 24-hour fast or 500 calories or less. I would say that one's been around actually for a long time and implemented. It's actually used quite frequently in Europe. Also really great effects on insulin, really great effects on cardiometabolic health, and really great effects on weight loss. So you're starting to see a pattern, right? Like there's multiple ways of getting to point B. It's just what's going to be feasible for you. And then we get into the more like extreme version. So water only fasts. And this is definitely more periodic. This is not something sustainable long-term, because really with a water only fast, you're not only just fasting, you're doing calorie restriction, and calorie restriction long-term can cause a whole slew of health problems. And so I think a lot of times we get so caught up in like the flashiness of fasting and the benefits, right? But we don't talk about the dangers, especially with water only fasting, especially for people who are doing it fairly frequent. And it can be anywhere from 24 to 72 hours. A 3-day water fast it's hard. It's definitely a challenge, but you can get more side effects that way. So more dizziness, low blood sugar, dehydration, hypotension. So a lot of times blood pressure drops, fatigue, and even like in a severe case, syncope, so passing out, can happen, which we don't recommend, right? So a water-only fast is best to do under medical supervision. There are clinics actually that specialize in this. And so I interned at one called True North Health. It's in Santa Rosa, California. And the director there, he's been doing this for like 20 years, but you kind of it's an inpatient, 24 hours a day. They're doing labs all the time because it's so variant from person to person how well they're going to tolerate it. One of the things is we don't want them to get dehydrated, and so electrolytes need to be monitored. But just a really interesting thing with water-only fast. So this clinic, he has 100% remission for people with high blood pressure, cardiac issues, all the metabolic syndromes. I mean, he has 100% improvement, right? So there's no doubt that it works. It's sustaining it, right? So once you get released from it and you return back to a standard diet, the effects don't always remain, right? So that's where the struggle lies. Like, how can we get the best of both worlds? And then there's a newer version that I actually am a huge fan of. I really like the doctor behind it. He works at the University of Southern California Institute of Longevity, Dr. Walter Longo, and he developed the Prolon FMD fast. So this fast is interesting in that it provides the effects of a 3-day water fast with food. So you have a 5-day program. It comes with all the food you eat, and the macros in the kit are very specific to basically switching you into ketosis. So it's a low protein diet essentially, but it lowers the risk of people doing like a longer day fast at home. And he's actually seeing a lot of benefits in reduced blood pressure, reduction in lipids, better inflammation response, and lower IGF-1 levels. And so they're actually taking their research and applying it to like a broader spectrum of diseases like cancer, chronic illness, autoimmune conditions, such as like Crohn's, colitis. And so they're like really, I feel like, on the revolution of developing this kind of as a prescription to use for a lot of doctors' offices, right? Like, instead of coming in and getting a medication, well, here's your prescription. It's this very specific diet to take home, and it comes with everything. You don't have to go buy anything. And so we can talk about that later too, but that one's kind of, the downside is it's obviously cost limiting for a lot of people. It's a little bit pricey right now. But it depends, right? Goes back to like, what are the indications? Like, why are we recommending this? And so who should do intermittent fasting or fasting of any sort? Anyone with like metabolic syndrome. So usually how that presents is people who are overweight or obese, especially abdominal weight, which we know is super inflammatory because it surrounds the visceral organs, which is dangerous. Athletes a lot of the times use fasting to improve their energy levels and their endurance, because we're seeing such great improvements in things like growth hormone and maintaining lean body mass, which is important for athletes. This one's arguable, but longevity. So anyone who's interested in like anti-aging medicine, that really is where Dr. Longo's research is coming into play and figuring out like, how does this affect, right? Like with the stem cell production, like does it, add years to your life? Like what's going on with that realm? Obviously weight loss, it just, like I said, especially for a lot of my patients that have struggled in the past with like yo-yo dieting. I mean, this is really a game changer because it's challenging and it's really addressing the root of the issue, which is insulin. So there's a lot of people it's indicated for. Who we don't want to have fast. So obviously women who are pregnant or lactating, so breastfeeding, because part of fasting just is calorie restriction, right? And so pregnancy is a time of calorie abundance, right? Like you're growing another human inside of you. We don't want to restrict calories at that time because we want, let alone feeding you need to feed another human. Breastfeeding too it's not a good time because with calorie restriction, you can also see a decrease in milk supply. And depending on how old the baby is, they may not be at that point where they can just stop breastfeeding. Eating disorders, I always high screen because you don't want to re-encourage a habit that may be repetitive for the person and may put them at higher risk, especially binge eating. We have this issue, especially when you do like an alternate day fast, and people with history of binge eating, it's hard for them to control. So like on their feeding day, they tend to binge, which actually negates the effects of the alternate day fast. And then anyone really with type 1 diabetes, I would highly encourage them to talk to their doctor, because type 1 diabetes is different than type 2. But those are the ones that I would say are the highest at risk. And then definitely not if you're trying to conceive as well, because preconception is just as important as conception, right? That's a time of like high nourishment. We want to encourage your hormones to be at their peak. And sometimes fasting, which this isn't discussed also in women, is different than the effects of fasting in men. So something to remember.
Great point.
So Dr. Maral, you've given us such a great overview of what fasting is, different kinds of fasting, who it's for, who it's not for. And so this is our part 1 of intermittent fasting. And I'm wondering what the takeaway you could give to somebody who's listening right now, maybe somebody who wants to get started and try one of these fasting techniques, or somebody who just wants to read more and kind of understand what it is. What's a takeaway to what you've shared today for somebody?
Yeah, that's a great question. I think there's just so much information out there. It's hard to tweeze like what we know and what we've researched to be good outcomes and what can be more detrimental. I would say anyone who this is new and they're testing the waters, I would say, what is your goal? What is your outcome, right? Because fasting isn't meant to be, something you do forever. It's cyclical for a lot of people. And so I always invite people to think like, what is your goal? What is it that you want to achieve? And then we can tailor the program specifically to that person, right? Because some people, their main goal is maybe they have a lot of issues with their cholesterol, and they're just wondering how to sustain, lower their family risk factors. So things like that. So I always ask people like, what is your goal? Really sit down and think about that. And then we can always discuss where to move from there.
All right, great. Well, we would love to have you join us again for a part 2 where we can dive in even deeper into this topic and hear even more about how it can help with physical health and mental health or emotional health, and just ask you a lot of great, more in-depth questions. So thank you for joining us today.
So informative.
Thanks, guys.
Talk to you very soon. Thank you for
We'll
listening.
see everybody later.
Bye.
Bye.